Greetings, everyone. Dr. Jack Wolfson. It is an absolute pleasure to be here with you. Congratulations on finishing up the 28-day Heart Health Challenge. And I, first of all, want to thank my team for developing the program with me and getting the message out there to you. I'm flying solo tonight, along with hundreds of you who are here on the call. Dr. Latanza is not going to be joining us for this presentation tonight. But don't worry, I am ready to rock and roll and give you the best information that I possibly can. We have a lot of questions that have been submitted. So go ahead and jump into the chat box, add more, and I will go rapid fire. For those of you who have heard me talk before, you know I can go rapid on these questions and I will get it done ASAP. Again, thank you so much for being here. Congratulations on finishing up the challenge. It is a tremendous milestone. A lot of people did all 28 days. And again, that is just absolutely spectacular. What an accomplishment. What an accomplishment that you all achieved, really. Now, a lot of people are asking kind of what to do next, and I'm going to address what to do next. I'm going to go through all these different questions. We'll be talking about high blood pressure, talking about cholesterol, talking about coronary artery disease, CT scans, best tests, oxidative stress, all these various things. But I do want to remind you that we are going to be doing a webinar, which is essentially like a nutrition 101, but we're going to be talking about 5 things that you need to know for optimal heart health as it relates to nutrition. Now, of course, as you go after the nutrition for heart health, everything gets better. Brain gets better, heart gets better, lungs get better, kidneys get better, immune system gets better, the whole thing. So again, I'm going to answer your questions. I'm going to go rapid fire on all these various things that we have. And again, I'm so grateful for my team that helped me put this all together, that got the information out to you. And my team is here monitoring in the chat as well. So they may put in some extra links or something like that. If I tell them to put in a link, you can click on the link. It's going to open up a new window for you. You're not going to lose us. If you lose us, go back to the original link that you came from and get back into here as well. So, and also, again, thank you to Dr. Latanza, Dr. Tanya Rainier, our other cardiologist, Dr. Andrew Rudin, Dr. Shanna Baird, Dr. Keith Smeagol, and our team at all the health coaches as well. So JP7, hello from Cambodia. Look at you, man. Pretty good. Okay. So what to do next? Well, you want to keep going with the wins. You want to wake up on a daily basis and say, what's one thing that I can do today that will be healthy for me? Now, of course, if you do more than that, great. But you always want to wake up, and whatever your routine is, maybe you wake up and brush your teeth. Maybe you wake up and go to the bathroom. Maybe you wake up and have a cup of coffee. Maybe you do all 3 and more. You need something to look towards that you're going to be doing that particular day to make a difference. And ideally, it would be something even new. So today, we mentioned teeth. So today I'm going to look for natural oral healthcare products, or I'm going to do an oral detox or cleanse. And the good news is, my friends, is that you can do so much of this on your own. And we're here to guide you, and you can bounce stuff off of us, and you can go into the Facebook group. I know a lot of you don't like Facebook, and I understand all the reasons why. It just happens to be a very good place for us to be able to communicate. And you can communicate with 30,000+ other people in the group and ask questions. Now, you can also go to Google and you can search on Google, and you can also, go to, your phone and use something like ChatGPT or AI and ask questions. Now, I think those are good places for education, but then you're going to want to bounce it off one of the doctors at Natural Heart Doctor. because we can help you as an individual versus they're giving maybe more generalities. So again, and you can ask for lifestyle tips, but we'll certainly send you those various things. But you can certainly educate yourself. But if you're looking for the advice from 75 years of medical experience between Rudin, Latanza, me, Rainier, Baird, Smeagol, actually including Dr. Smeagol, we're talking about close to 100 years of experience, which is a lot. And in particular, Rudin and I, coming from the hospital system, Dr. Rudin worked in the hospitals for over 20 years. I worked in the hospitals for over 10 years. All right, so that being said, let's jump into it here, because again, a lot of people are saying what to do next, and I could just say, keep following us, keep working with us, follow us on YouTube, follow us on Instagram, follow us if X, you can follow us on X, which is the old Twitter. We're trying to get out and of course read our emails every single week. My good friend Brian on our team at Natural Heart Doctor puts together our newsletter, and it comes out to you every Sunday, and it's full of information. It's got recipes, it's got action plans, it's got stuff to do that are going to make you healthy. And also, I want to remind you, and you've heard me say this before, sharing truly is caring. Sharing is caring. When you share this information with people, you just may save a life. When you're at holiday dinner and you have these discussions, when you are sitting behind your desk or on your phone, and share with your people. Because if someone didn't share this with me, and that woman would quickly become my wife, whose birthday it is today, by the way, and I'm doing this on her birthday, which she's in fully support of, and we will celebrate more after this. So if she didn't tell me this information, it would not have created who I am to be able to help all of you. So there you go. Happy birthday to Dr. Heather, right? There we go. Okay, good. All right. So let's jump into this. Some of the questions that were sent in ahead of time. So, someone said, what are the most important habits from the challenge and why they work? Well, the most important habits from the challenge and why they work are that actionable, small, daily tasks, one a day, makes a difference. We started off talking about hydration. We talked about sleep. We talked about movement. We talked about building muscle mass. We talked a lot about nutrition. We talked about testing. So each one of those things all makes a tremendous difference. What are the first three things you would do to treat blood pressure, cholesterol, sleep, stress, energy? The first three things that I would do, and this is for anybody, the first three things that I would do if I wanted to get as healthy as possible, as quickly as possible. And this is not easy because there's a lot of things that I think are really important. So let me say this. Number one, immediately start eating more seafood. I love seafood. Seafood is brain food. Seafood is heart food. The omega-3 fatty acids found in seafood are the best source of food-based fats. And seafood is also seafood. So many people have eye problems. My eyes are wonderful. My eyes are wonderful. My skin is aging. I am gray. I've lost most of my hair. Remember, for the first 33 years of my life, I was eating fast food. Diet Mountain Dew, just totally toxic lifestyle. And of course, as a hospital-based cardiologist, not sleeping, not getting good sunshine, all those kind of things. Okay, so the first thing I would do is eat more seafood, and that's pretty easy. The second thing is I would go to sleep a little bit earlier. Try and go to sleep 30 to 60 minutes earlier than you normally do. I think that's very important. The third thing I would do is make a habit of getting outside more often. Getting outside more often. Go for a walk after every meal outside. Bundle up. Maybe the weather's not that nice where you're at. We're coming into springtime. It'll be summer before you know it. So get outside. The more time you spend outside, the longer you live. All right, here's a question from Vicky. I've had a calcium score done. What are the benefits of the heart attack risk test you offer, and how are they different? I don't like coronary calcium scans. They are radiation. They are fraught with problems, meaning if it's a high score, you're not immediately in trouble. If your score is 0, you're not safe necessarily, because you could have a lot of soft plaque. And the main issue, in addition to those two, the third thing would be is that the score doesn't meaningfully change over time, except for it gets worse. Now, we've had a lot of people who their score has gone down, and we've had a lot of people who have stabilized things where it doesn't really get worse. Now, again, I don't push the scan. I don't push the scan. The scan represents old stuff. When you get the heart attack risk test, it is about new, what's going on right now. So when you order the heart attack risk test, which is a measurement of oxidative stress, that's happening right now. And that's something that we can change quickly by changing up you, making you eat better, live better, think better, all those things. So if you have a very high calcium score, yet your oxidative stress is low, your risk is much lower. Because the coronary artery calcification, that could have been from 10 weeks ago, 10 months ago, 10 years ago. It's a whole lifetime of issues. If you were around secondhand smoke as a child, you have a much higher risk of elevated coronary artery calcium. But what does that tell us about your status right now? I think the other problem with the coronary calcium scan is that it leads to other tests. Now you have a billable diagnosis, so insurance starts to pay. They didn't pay for the coronary calcium scan because insurance companies know that it doesn't help. If it helped to limit their costs, and let's say altruistically to help you live better, live longer, then they would pay for it. They don't have some vendetta about the test. They know that that test and total body MRI tests, they know that they lead to a lot more useless testing. So I hope that makes sense. The heart attack risk test is a simple at-home urine test where you can get the results quickly. You review it with one of our healthcare practitioners at Natural Heart Doctor, and then we come up with an individual plan to start to improve it. Can you lower your ApoB naturally, or are medications required? Well, if you know me, I am not a pharmaceutical guy. I'm a prescription medication last and do everything else first kind of guy. So remember, ApoBs are on the LDL particle. So the liver makes LDLs, and the LDLs, if you think of them maybe as a baseball, the stitching on the ball is the ApoB. The problem is not us making too much of them. The problem is the body doesn't clear them. So we can use various strategies to clear ApoB particles. We can use pharmaceuticals. Statins don't do it. Statins stop the production. But if we want to increase the clearance of LDL particles, we can use an injectable like inclisiran, which is Praluent, or Repatha. But I don't like those pharmaceutical drugs. I can use something such as a liver cleanse. And we just wrote a blog post on this that I think is great. But also our product called Optilipid is 7 different natural ingredients with 75,000 studies in total on those ingredients, that one of the mechanisms of action is that they increase the number of receptors on the liver that recognize ApoB and pull them out of circulation. That's what we want to do, and we can do it naturally. Let's go with that route first. All right. And Lisa had also asked how to improve small particle LDL size. Well, what we want to do is we want to clear out those old, small, dense LDL particles with a product like Optilipid. The other thing that is known to increase the size of LDL particles is time-release niacin. Time-release niacin, according to the Coronary Drug Project, before statins were ever released, showed that niacin lowers your risk of dying by about 15% versus those who were on placebo. So niacin is definitely part of our cholesterol protocol or cholesterol stack. Time-release niacin is also useful if we have elevated LP little a. All right. Now we also have questions regarding someone had asked if you can get an accurate reading about oxidative stress if you have a stent. Yes. The answer is yes. There is really no scenario where someone would not get a lot of value from the urinary oxidative stress test. I would say don't do it if you're on steroids, oral steroids, prednisone or similar. Don't do it if you have an ongoing infection. But if you're feeling your typical state or status, then it's a good opportunity to get that particular test. Another question is about atrial fibrillation or recurrent atrial fibrillation. And that's really where our specialist, Dr. Andrew Rudin, comes in. I highly recommend a second opinion consultation from Dr. Rudin. Yes, it is an investment. He charges $800 for his 45-minute second opinion, where he reviews all your records and he has a conversation and he comes up with a comprehensive plan. I have paid more to a plumber to come to my house in Colorado to fix a leak that took him 20 minutes. I've paid more to that guy than, and no disrespect to that guy or to plumbers for that matter. My point is that I get it that there are costs in life. I get it that there are things that we can either choose to invest in or not. I understand that a lot of people are on fixed income. I do. And for that, again, I would, again, love to offer the services of Dr. Rudin. And again, we also have a great team of health coaches. I've got some wonderful free blogs on AFib. We even have a course on AFib as well. Okay. All right. Here we go. Vicky said, if I take Optilipid, do I still need omega-3? I don't like omega-3 supplements. I like Optilipid, and I like eating seafood, and I like our product called Wild Salmon Roe, which is Lummi Island Seafoods, Wild Salmon Roe, freeze-dried and encapsulated, and you get the benefits. You do that on a daily basis. Okay. What supplements you recommend for CHF? We have a good area on our website that talks about the protocol for CHF. But if I want to help the heart, kickstart my heart. I'm thinking about, we have really moved to a food first company where our foundational products kickstart my heart, which is the elk liver heart kidney, wild salmon roe, minimally processed emu oil. Those are going to be our foundational products that I think are really going to be beneficial to you and to everyone else. Can we take Optilipid, or what can I take instead of Optilipid to lower LDL particles, because berberine is not compatible with insulin pump? So berberine is compatible with an insulin pump. You may get away with a little bit lower insulin dose. Check with your doctor, but there really should not be any problem. And Optilipid only contains 500 milligrams total of berberine per 2 caps. So it's not the mega dose of berberine. We're trying to get by with a little bit a lower dose. So again, I don't think that's an issue with somebody with an insulin pump. If you were my patient, I would say, let's go with it. Now, we do also have garlic force. That is definitely helpful. We do have time release niacin. That's definitely helpful as well. Emu oil, kickstart my heart, all those things are all going to be really good. Okay, let's see here. What would you advise for reducing plaque? Is natto the best to use? Well, we like a product that we developed called Flow, and Flow has nattokinase and serrapeptase. So we're hitting it from 2 different enzyme angles, and the data is certainly good as it relates to nattokinase and reducing plaque volume, plaque size, and maybe increasing stability. And then also because it's a natural fibrinolytic, that if you are forming these clots, that the body is breaking these down. Now, remember, back in the day, if you had a heart attack, you got streptokinase. This was injected IV. It was very powerful. It was very effective. But unfortunately, sometimes it was so effective, people had brain bleeds from it. So nattokinase works orally. It doesn't work as strongly as IV strepto, but it works. It works. What do I think about sauna? I am a fan of infrared sauna. The main data that we have on sauna is the good old-fashioned sweat box, where we see that people who go into a sweat sauna for 20 minutes, 4 to 7 times per week, have a much lower risk of being dead. So that's certainly good. Kenji, regarding AFib and ablations, I think that ablations are a last step approach. So if we have symptoms and we can't control everything through natural methods, then we have ablation. But ideally, we optimize you before an ablation, because if you're optimized, meaning you're eating well, living well, thinking well, you're taking evidence-based supplements, we test you and your inflammation's low and your oxidative stress is low and your chemical burden is low, then you're much more likely to have a successful ablation. Remember, ablations fail half the time, and that's at the 12-month point. So if you're going to do a procedure that has radiation, that has potential for complications, you want it to be one and done, successful. You don't want to be someone who goes in for multiple procedures. All right. How do I clean my arteries? So we do like that product called, everything we do, remember, it's always about foundation stuff. Supplement. So we're eating well, we're living well, sleep, sunshine, movement, getting away from all the toxins. That's going to be our strategy to reverse plaque, stabilize plaque. And really, it's not even about plaque reversal, people. No matter what your plaque is, as you're listening to me right now, you can live for another 150,000 years with your heart the way that it is. We just don't want the plaque to get worse, but we don't want the plaque to erode or rupture, leading to a myocardial infarction and potentially death. So Flow is a really good product there. The other product is Arterosil, Arterosil. The active ingredient in there is a rare form of seaweed, and there's a lot of cardiologists natural or not, that are recommending that as well. All right. So Julianne says, I ordered the stress test, injured the knee, had to have a steroid shot. When is it safe? So it's not safer not to take the stress test. You can take it, but I would probably say about a month after the injury would be good. And no, you do not stop supplements before the oxidative stress test. Is it possible that complete in-canal hearing aids can throw you into AFib? It's possible. Hearing aids are electrical. They are Bluetooth very often. And they can, again, electrical. Your heart's electric. AFib is an electric problem. Now, it's very important to hear. So you have that, potential trade-off, but it definitely is a possibility. When, again, my team is saying, when we receive the results back, you also get a copy of the oxidative stress test results, which is the only stress test you really need, especially if you're not having symptoms. But our team will also reach out to you to schedule. Will milk thistle and optilipid lower efficacy in meds? No. Okay, inside of there is silymarin. What percentage can optilipid lower LP little a? Remember, LP little a, it's a combination of eat well, live well, think well. Optilipid can be efficacious in lowering LP little a, probably about 10 to 15% on average. Some people better, some people worse. But also, since LP little a leads to hypercoagulability, I think, or sticky blood, I think that's what's great about this product, is that it's going to give you some nice natural blood thinning. Now, I definitely like arterial and flow in people with LP little a if they're concerned about the hypercoagulability aspect. Someone is asking about flow versus aspirin. And they are different. So there's different things in the blood that form clots, one of which is platelets, which is where aspirin works to block the efficacy of a platelet. Flow works as a natural clot buster. So they both have a role. They both act differently. I don't like aspirin because of its gastrointestinal side effects, one of which is gastrointestinal bleeding and ulceration. So I don't like that particular drug. Linda, I'm not a huge fan of red yeast rice. It's very similar to statins. I do like optilipid. And don't forget sunshine as a strategy to improve your cholesterol. Because what happens is when you're out in the sun, the energy from the sun turns cholesterol into vitamin D. This is not conjecture. This has been known for probably 100 years. The sun, the UVB from the sun, turns your cholesterol going through the skin. It turns it into vitamin D. Vitamin D levels go up and cholesterol levels go down. Now, it's not about driving cholesterol levels down necessarily. It's about using natural strategies to optimize your health and to improve your cholesterol, okay, to where it should be. Is HRT a good or bad thing for female postmenopausal hearts? Our ancestors went through menopause and they didn't have hormone replacement. I believe that they went through menopause very well, very well. And when you struggle with menopause, it's because of violations of eat well, live well, think well. I'm not one of the people who are better living through medical chemistry and recommending those products. Now, you can also get some of the hormones that you need from eating a product like Kickstart My Heart. You can get that from wild salmon roe. So you're giving your eggs, you're giving your body that nourishment. I think hormone replacement can be reserved for people who they're doing everything to their best of their ability, yet they still have menopausal symptoms. But I don't think that we are built incorrectly, and therefore every woman needs hormone replacement when they're postmenopausal. My wife still menstruates, and she's coming to the end of her menses and will be menopausal. And she will not be taking hormone replacement. I can assure you. I can assure you. And if something, again, if my opinion changes, I'll tell you about it. Now, I understand people can come back and say, oh, well, listen, you're not a female doctor. You're not, how do you know? You've never gone through menopause. I mean, I'm telling you my opinion, obviously. So there you go. And what else do we got here? Optolipid, the stuff has worked wonders for me. Been on it for 6 months, and LDL and blood pressure way down. I'm off all statins and blood pressure meds. There we go. Pretty good. Grace, I'm on Eliquis for AFib. So Grace, what you want to do is you want to look up your CHADS VASC score, and you want to see what your annual stroke risk is. You can go to the website CHADS VASC. So it's CHADSVASC.org, chadsvasc.org, online stroke calculator, and you can see what your annual stroke risk is. And then you can take Eliquis and you can drop that risk by 60%. Obviously, you will increase your bleeding risk, but the higher your CHADS VASC score, the higher your risk, the more benefit of Eliquis, but there are natural strategies for sure. And I want to tell you again that if you're struggling and it's just no one's giving you answers, and I think menopausal stuff too goes along with this, please do the number 8 Swiffer test or naturalheartdoctor.com Swiffer. And that's going to be a home test for water damage, mold, and or bacteria. If you know you live in mold, if you know you have water damage, you better get it fixed, or you better move out, or you better do something, because it will, I don't mean to be so cataclysmic about it here, but it'll kill you. It'll kill you. Dr. Rudin suggested that I don't take pomegranate juice for atherosclerosis because of the high sugar content. Yeah, I'll disagree with Dr. Rudin on that one. I mean, I think that if you do like a 1 ounce shot of pomegranate juice, I don't think it's a problem. The polyphenols that are in there are tremendous. There's other ways to get that than pomegranate juice. And whatever kind of juice product, you always want to make sure you got to drink out of glass. You got to get rid of the plastic. What are my thoughts on Paleo Valley products? I think Paleo Valley has good products. They have an organ complex that you could take. It's, I think, half the price of Kickstart My Heart. My product is better. My product comes from better, healthier animals, and we have to pay a lot more for them. That's why our product is more expensive than Paleo Valley. So if you want to take organs and only choose to purchase a $60 bottle from Paleo Valley, but ours is more expensive. And again, you can spend $2 a day on their organ complex, or you can spend $4 per day on Kickstart My Heart for an extra $2 per day. And I understand it adds up and stuff like that. You're just getting a better product. You're getting an unvaccinated, prairie grass-fed, field harvested animal, no chemical bathing, young animal that was living its best life until it was sacrificed for our benefit. Cattle are hybridized. They are not field harvested. They are medicated and vaccinated. A lot of times they are not completely grass fed and grass finished. The elk are. The elk are. How do I get my doctor to order an oxidative stress test? Well, there's not, insurance does not have anything that's urine home test. You could get an ox LDL. Your doctor may order that, and insurance may pay for it. The other general measurement is MPO, myeloperoxidase. How do I avoid SVT during pickleball with a healthy heart? Well, I think what you got to do there is you got to just continue to eat well, live well, think well. And I would test, don't guess. Maybe there's some vitamin, mineral, CoQ10, omega-3 nutrient deficiency. Maybe there is some toxin excess that pickleball throws you over the edge. So get tested, please. Yeah, Nancy, again, what appeared to be a TIA, that's primary care doctors and cardiologists. It's just a reaction. It's almost like a reflex. Like if you went to the doctor and they took out the reflex hammer and they were checking your reflexes, in your knee, whatever, and your knee popped up on your, patellar tendon. It's just a reflex of what they do. And I know because I did it for so many years. But I want to know why your husband had a TIA. It's not because they were deficient. He was deficient in clopidogrel, aspirin, and rosuvastatin. So, and really the CT scan, I think that also, I would do an ultrasound of the carotids is what I would do in that scenario. And I would probably do a 2-week Zeo patch looking for AFib. But what I would do would be to figure out, okay, these are all the good things about your husband. These are the bad things about your husband. And then move the bad to the good category. And then we would also do the most advanced non-invasive testing. Randy Martin, I don't like Xarelto. If I had to pick one, I would choose Eliquis over Xarelto. Chelation doesn't work. I don't like chelation. That data is clear from the TACT trial. Is it possible to reverse cardiomyopathy with supplements? It is definitely possible to reverse cardiomyopathy when you eat well, you live well, you think well. Ideally, test, don't guess. And then, yes, there are evidence-based supplements that can help. Meredith said Eliquis versus nattokinase. Again, I like our product flow. I'm not saying this is not medical advice, obviously, but I'm intent on working with people to get off pharmaceuticals safely and effectively. If you want to do a consultation with me on these things, which are very important things, if you want to hear my personal opinion about you, you're welcome to. I charge a lot to work with me personally. I just don't have the time. I love it. I love talking. I love talking to each and every one of you. But I'm also trying to come up with as much information to the world that I don't really have a lot of time for one-on-one. So I charge a lot of money for my 101. Now, the good news is Dr. Rudin is amazing, and Dr. Latanza is amazing, and Dr. Rainier and Dr. Baird are phenomenal. Scott, how do you reduce carotid artery plaque? Same way as coronary plaque. Eat well, live well, think well, test, don't guess. Evidence-based supplements, biohacking strategies. Susan wants to know about heart palpitations to begin when you're hungry. Listen, the heart and the stomach and the gastrointestinal tract are one. We are all one. We are not a silo of heart, liver, kidney, and all these different specialists. They're all intertwined. Now, in this particular case, of course, the vagus nerve controls the heart and the gastrointestinal tract. So if you have issues going on from a gastrointestinal standpoint, it can manifest in the heart and vice versa, but usually gut first, then heart. Blood pressure is very high when you go to altitude. Well, that's certainly an interesting one. It's likely, again, that when you get to altitude, your body doesn't like it for whatever reason, and then your blood pressure goes up. I think there's various things that can be done, like maybe it's a magnesium issue, maybe it's a potassium issue, maybe it's a CoQ10 issue, maybe it's an omega-3 issue. That's where test, don't guess could really come in helpful. Beth, my husband is a wheat farmer, and I know you said it's not a good flour. I've kind of softened my stance on organic wheat, heirloom wheat, sourdough. I've really softened up my stance there a lot because I really come to understand that it's all these environmental toxins that are damaging the gut microbiome that leads to a leaky gut, inflammation, oxidative stress, endothelial dysfunction, autonomic dysfunction, coronary artery disease, atrial fibrillation, high blood pressure, heart attack, stroke, dead. There you go. Chronic ischemic demyelination due to heart disease. What should I be prioritizing? Again, seafood, seafood, seafood. I'd be looking at toxins that are leading to your condition. Can red light therapy help blood pressure? Yes, but not as well as the sun does. Let's see. Joan Tedeschi says, thank you so much for the challenge. I really loved it. Me too. Calcium score is elevated. Yep. This is all, the key is, again, to keep oxidative stress low. That's the best thing you're going to do. If you switched off Carditone, then I would probably go with our product Vessel Support for blood pressure. Best product for stress. The best, again, aside from remember, the foundation is the food products, wild salmon roe, Kickstart My Heart. Give your body everything the body needs to get the job done. In particular for stress, though, I do like our product called Cardiolith. It's a low-dose lithium product. And lithium is very engaging to the parasympathetic nervous system to kind of chill. Docs keep pushing statins to GMOB1. I want to be very clear about this, people. You are the captain of your ship. Nobody else. You're the captain of the ship. You decide what's best for you. You research. You decide if you're going to take a drug or a supplement or what you're going to eat, how you're going to eat, live, and think. And the tests you do, you decide. Now, if you're in an emergency, if you're in the midst of a heart attack, go listen to them. If they say to you, okay, sir, you're having a heart attack, we're going to the cath lab in 3 minutes. Go, do it. You got to do it. If it is a traumatic situation, something's broken, let them fix you. What I'm saying is that they're really good for emergencies and trauma. But we're talking about the reversal of chronic conditions. So do you think that if you've got a high calcium score and triple vessel coronary artery disease that's been building up over your entire life, do you think it's an emergency to start a statin tomorrow or right then? Oh, sir, your score is at 1,500. You got to take this prescription over to the pharmacy right now. Start it right now. That's craziness. Does that make any sense? No, you've got time to think about it. You've got time to ask us for a second opinion. All right. All right. Remember, guys, is that, if you're financially struggling, we also do these complimentary discovery calls. You're not going to be speaking to a doctor. You'll be speaking to one of our coaches. And our coaches are going to give you some information. They'll point you to, maybe a blog post or some supplements that they think may be helpful. They may tell you, hey, listen, we definitely recommend working with a doctor. But we want to give you options. What you do with the options is up to you. How you spend your money is up to you. I don't mean to be flip about it. I don't mean to be arrogant about it. But, sometimes over the years, woman comes in, woman makes a comment, I don't have the money. Now, the woman just got her hair done, which is very expensive. She's got a fresh pair of nails on, maybe some eyelashes, some jewelry. She looks good. wearing some perfume. If that offends you, I'm not sorry. I hope it offends you if you're doing it. So you got to prioritize. What about the Starbucks Frappuccino? What about that? What about the tub of ice cream? So someone says, I can't afford $4 per day for your unvaccinated field harvested elk liver, heart, kidney. And I come back and I'm like, I'm sorry you feel that way. Like, I feel you're worth it. You may not think you're worth it. I feel you're worth it. Can you get $4 per day from somewhere to take this product? And if you take Kickstart, let's say the whole thing is $9 per day. Where can you get a cheaper car? Can you live in a less expensive house? We had somebody, years ago say, oh, I can't afford to do this, this, and this. They live in a house in Scottsdale, Arizona. Well, if you want to prioritize health for you and your family, because they were like, oh, I can't get grass-fed, meat and stuff like that. It's too expensive. So move from Scottsdale to some other part of the city. Right, Brian, you're on the call right now. Are there other parts of the valley that somebody could move to if they want to prioritize their health over the location that they live in? Well, the schools are better. Who cares about the schools? If you don't have your health and the health of your family, you got nothing. You're cooked. Best strategy for stress, anxiety, figure out the root cause, and eat well, live well, think well. Cardiolith is very good to slow down the heart rate. It's good to chill your nerves. Our ancestor, lithium used to be in the soil. It's not a pharmaceutical. Lithium used to be in the soil, and farmers do not add lithium to the soil. It's not a concern. So I think it's really kind of replacing what's not in our diet. And that's how the company who makes our product, Biotics Research, they put lithium into the soil, they grow a plant, harvest the plant, and put it in a tablet. Cardiolith can help the vagus nerve. Black garlic gel capsule. We sell a product called Garlic Force. I don't know about the one. Garlic is definitely good. Now, garlic has a lot of medicinal nutrients that are in there. But garlic, I think one of the main benefits is that it's very high in sulfur. Sulfur is in garlic, and it's in eggs, and it's in onions, and it's in brassica vegetables like broccoli and cauliflower and Brussels sprouts. It's in all animal products. And sulfur helps to create glutathione for detoxification. Sulfur makes the blood vessels slick. You may have heard of chondroitin sulfate for joint and cartilage issues. A lot of data. Epsom salt bath, soak in an Epsom salt bath. That's magnesium sulfate. Sulfur is super good. For seafood, no, I'm not talking about cod. I'm talking about medicinal food, wild salmon, sardines, mackerel, anchovy, tuna, clams, oyster, shrimp, lobster, crab. There you go. Triglycerides, eat well, live well, think well, eat more seafood, less sugar. Not a big fan on peptides. I'm just not. I mean, certainly not pharmaceutical peptides like semaglutide, Ozempic. It's going to end bad with those drugs. It's going to end bad. Anytime you slow down gastrointestinal motility, I think it's cancer waiting to happen. You want to increase motility. So what about using Truvaga for the vagus nerve? Totally recommend that product. Yep. What is a stiff heart? Stiff heart means it doesn't relax. The heart contracts and the heart has to relax. Heart needs energy to relax. How does the heart get energy? Eat well, live well, think well. In particular, one thing is CoQ10 helps the heart relax. Magnesium helps the heart to relax. Will your supplements help or hinder my high uric acid? They will help to lower uric acid. We also have a product called Kick Your Acid. Kind of a strange name, but there it is. There's benefit to aged garlic. There's benefit certainly to cooked garlic. There's benefits to raw garlic. Heart Helpers helps the heart because it is a probiotic that helps improve the gut microbiome. There's 10 different probiotic strains in there that I sourced from the medical literature, had a company make it for me that is famous in the probiotic industry. And that's what the product is that it helps to colonize your gut microbiome to seal your leaky gut. Your gut bugs are part of your immune system. They process your food. They make vitamins. Very important. Fermented foods, raw dairy, sauerkraut, kimchi, kombucha, all very good there. So stiff heart can definitely improve. The probiotic that we use is called Heart Helpers. Gas, bloating, etc. That is obviously, it's a digestive issue that usually starts in the liver. So I'm thinking Kickstart My Heart for that. We also have a product called Digest Plus. Maybe the combination right now, but eventually you'll get off the Digest Plus. You should never stop taking Kickstart My Heart. I take it every single day with my morning coffee. High ferritin is usually from inflammation. It could also be from high iron. But the problem is not the iron. The problem is what's causing your iron levels to go up, which is typically a nutrient deficiency. Very often that is a copper deficiency. Tuna can have high mercury. There are canned tunas that are low in mercury. I really have not seen much elevation of mercury from tuna eaters personally. And I'm not overly concerned about mercury levels from tuna. I wouldn't inject mercury, of course, but I don't eat a lot of tuna, but a little bit. We do parasite testing. That is called the tick-borne panel from Vibrant. We have that on our website. And we also are developing a parasite cleanse. It's actually my wife's company, Wild Mamas. She'll be doing the parasite cleanse. That's going to be from like nasal all the way to your tushy. Water fasting for overall health. Water fasting's good up to 72 hours, maybe even longer, depending on your weight. I also like a 24-hour dry fast. It's biblical. Dry fasting is beneficial. Your body actually creates its own water. So that's pretty good as well. How to decrease diastolic blood pressure. We want to do various things as it relates to diastolic blood pressure. I like magnesium for that, our product Magna 5. I like potassium boost. I like CoQ10. All the things that we do help diastolic blood pressure. The one thing I would not do is pharmaceuticals. Collagen peptides, I don't know. Why do synthetic peptides or protein shakes when you can just eat the food? Like, why not just eat seafood that's full of collagen? Why not eat meat? Why not eat eggs that are loaded with, collagen-producing amino acids? If you're taking 550 of berberine, should I stop it? No, you can take Optilipin in addition to that, but you can try and see what works for you. Test, don't guess. Try what you want and then retest. Stopping AFib, I think magnesium is obviously a good start. Magna 5. Potassium boost is number 2. Again, Kickstart My Heart is foundational. Wild Salmon Roe is foundational. Emu oil is foundational. So, listen, there's people who want to take 30 products and then they're like, hey, what else can I take? There's people who take 3 products and they're like, you're killing me with all these supplements. Remember, a lot of the supplements can be opened as well, especially if someone who mentioned before they have digestive issues. You may want to try and minimize capsules, open up the capsules. Berberine drops my blood pressure drastically. Is there a replacement? Yeah, berberine is effective to lower blood pressure for sure. So, in that case, if you're looking for something for lipids, we're talking about Kickstart My Heart. We're talking about Garlic Force, TR niacin you may want to look into as well. Can you take CoQ10 if you're on Eliquis? Yes. Fasting good for AFib? Yes. I don't know anything about caca powder. Nattokinase may lower blood pressure. How to shrink or reverse aneurysms. You just want to give your body the tools to strengthen up your blood vessels. What strengthens up your blood vessels? Amino acids like lysine, proline, hydroxyproline, vitamin C. Copper is a big cofactor there as well. Copper is a cofactor for an enzyme called lysyl oxidase that makes those bonds strong. So, like for all that, I would do Kickstart My Heart. Fall asleep fast. Laura Lee, you want to go to bed on time. You want to stay off the tech. You want to go bed on time. No caffeine afternoon. No sugar with dinner. That's the strategy. Dihydroberberine, I mean, remember all the data, 9,000 studies on berberine are on berberine. Dihydroberberine, it's a new kid on the block. I'm going to reserve judgment on that. I'm not recommending it at this point. Stay tuned, but at this point, I'm not. Okay. All right. So that is the story to everyone. I went for an hour. Obviously, I love doing this. I could do this all night long. So ultimately, I'm a big fan of test, don't guess. What I really want you to do is, we talked about this earlier, do the stress test that you need. It's the oxidative stress test, and we call it the heart attack risk test. Because if you have elevated oxidative stress, you are at markedly increased risk of heart attack, stroke, cancer, dementia, Parkinson's, autoimmune, dying. So the heart attack risk test is what you need to get the job done. And here's the thing. You order the test and you include your birth date on the order. And we've done 1,000 of these tests, minimum, maybe 2,000. And we send you out the kit. You get the kit, you follow the instructions, very simple. It's a urine collection. You put it in the container, send it back to Genova Diagnostics. 40 years in business, one of the best lab testing companies in the world. Then you get the report, we get the report, and then we call you to set up the review. heartattackrisktest.com. Don't worry, we'll email you it as well. And so again, I really feel that not because again, you're getting the test, plus you're getting our professional consultation. And it's going to come from one of the doctors. So you're basically getting a free consultation from one of our doctors. I think it's a phenomenal test. I love it. You can actually, when you order it, you'll see what the test result looks like. And are you in the green, which is good? Are you in the yellow? Are you in the red? So yes, heartattackrisktest.com. My team just put it in there. Click the link, copy the link. Pay attention to your email. We'll send it to you. Check your spam. If you're not getting our emails, check your promotions. Check that out. Okay. And remember, keep up the good work from the challenge. Keep up everything you've done. You may have a bad day. You may have an organic ice cream day. You may have some alcohol. You may do stuff that you should not do. Maybe you go on vacation for a week. It's okay to fall off the horse, get back on the horse. Let's do this. You got it. Your life truly, truly depends on it. For those of you who are the older folks in your family, you're the inspiration for the young ones. If I'm eating lousy food, what makes you think my family members are going to eat good food? We are the patriarchs and the matriarchs of the family. Show your family how to eat well, live well, think well, test, don't guess, evidence-based supplements, maybe some biohacking strategies. Show them what health and vibrancy and longevity means. Show them by dancing at the wedding, by going for a hike, traveling around, riding a bicycle, water skiing. Show them what it means to be healthy. God bless everyone here. Have a wonderful, wonderful, wonderful evening, and we will see you all next time.